So my name is Eric Lederhouse. I'm a physical therapist with ARC Running, and I'm here today to talk about low back pain. So quick overview, we're going to talk about some risk factors for low back pain and give you more familiarity with anatomy of the lumbar spine. And I want to touch on imaging and the disc because that's a huge issue with kind of how to interpret that. Then we'll talk about some stresses placed on the back when running and how to navigate that, as well as exercises to perform or the ones that I love to give my runners. A common issue that I see in the clinic is people come with low back pain and kind of get this dull achiness. They didn't injure themselves, just kind of start coming on. And like, I don't know what happened or what caused the pain. So they go to see the doctor and they get this common diagnosis of non-specific low back pain. So it's not really, doesn't say anything. Is it from the muscles, discs, ligaments, and joints? And why do you have that pain? How do you treat something that's not specific? How do you understand what's going on? I think they just kind of threw that out there just to give it some kind of label. And over time, we understood a lot more how the low back works. So this is a very common issue we see. It's about 15% of runners may get it within a given year, and it gets progressively worse. So I have been practicing since 2009, and I see a lot of recurrent injuries, and especially low back. If you don't keep it in check, it may go away. And in fact, most of back pain does go away within 6 weeks if you don't do anything. But the issue we see is recurrence rates of low back pain because we fall in the familiar patterns, running form, or weaknesses that we don't address. So pull from that article, here's some risk factors, and it's not all inclusive, and I may even disagree with some. But what they're saying is if you've been running for greater than 6 years is one risk factor. If you're overweight, so BMI is a body mass index. And again, that scale is also controversial because really muscular people can have a high BMI, but they're very fit. But they're saying, hey, if you're pretty much overweight, which makes sense, it's more pressure on the low back. If you don't move, if you don't have any type of aerobic activity, there's a higher risk that you get low back issues. Not just running, like even just walking is a very good thing for your back. Leg length they've talked about, and then restrictions in hip flexion and extension. And by the way, the ones I bolded are the ones I'm going to talk more about in depth. If you don't have great hip mobility, the range of motion or movement will waterfall down to the back. And I'll explain that a little bit more later. And poor hamstring and back flexibility, they mentioned as well. To get everyone on the same page, let's talk about the lumbar spine first. We have 5 vertebrae in the lumbar spine or the lower back. It starts from the top is L1, L2, L3, L4, and then L5s at the very bottom. Clinically, we see most of the issues come at the L4, L5 level or the L5, S1 level. The reason being is it's a change of motion. So you see how the sacrum down here kind of starts to curve back. That's an area of higher stress. And of course, there's more load going through those 2 vertebrae because of just more weight. 95% of the low back issues usually come from that area. Now, if you hone in a little bit on that segmental level, so kind of taking a closer look, let's just say this is L4, this is L5. So here's the disc in between. Some key elements, you got the nerves. The yellow is the nerves, and they exit the spine and go all the way down to the foot. They formed the sciatic nerve. That's a bunch of nerves come together from one thick nerve behind your thigh and then splits to goes down to the toe. These nerves are very fragile. Nerves hate being compressed and stretched out. So if you get numbness or tingling, that's indicative of a nerve saying, hey, I'm being squished or overtensioned. So pay attention to that. For the sake of our talk, we're assuming there's no nerve-related issue. It's just non-specific kind of achiness, low back, localized to the lumbar spine or the low back. The disc is another element right here, which I'll elaborate more in a second with another slide, but that's a very important structure. It helps transmit forces and it helps the lumbar spine move. And to appreciate that, here is a disc looking from above. In the middle, it's called the nucleus pulposus. That's an area that has more water content. And as you kind of go towards the outskirts, that's called the annulus. It's more of a harder fiber type to kind of keep things together, if you will. So with this makeup, the forces can be transmitted through the spine, as well as it helps for movement in all directions there. It doesn't help absorb shock because by definition, it's a fluid-filled structure, so it's incompressible. So it helps just transmit the load through the spine. I'm going to stress the point that this is not a fragile structure. It's actually quite resilient. I won't go through each individual one, but ligaments attach bone to bone and help with passive stability of the spine. There's so many of them. So it's a non-contractile unit of the vertebral support, meaning it's not muscular, they can't contract, it's just there to keep it sturdy. And then if we get a little more superficial, we have so many muscles of the spine. And there's so many things that contribute. The abdominals, these multifidi group that go along the low back, but those help really support the spine. And a lot of us don't know how to train those muscles well. The big lats can really help the lumbar spine. The glutes help the lumbar spine. All of them help support and transmit the forces to absorb some of the shock going through the lumbar spine. A very common issue in low back is disc protrusions or disc herniations. Back in the 80s and 90s, they're to give you an image and say, hey, there's a disc herniation or protrusion. That must be the issue you're having. Let's go do surgery. But with time, we realized that even healthy backs have disc herniations or protrusions as well. They're just asymptomatic. One guy did a study saying, hey, what does it look like to have normal, healthy people come in that have no back pain? What do their backs look like? And a lot of the backs had abnormalities. So here's one finding of asymptomatic patients, no pain at all, that had findings of disc issues, disc degeneration, disc height loss, disc protrusion. You can see it goes up over time too. So I just want to make a note that don't feel worried if you get an image and you have a disc protrusion or herniation. It's very common. What I would speak to that is, okay, why is there more stress in that area? But it's nothing to go do quick surgery about or get too stressed out over, because it's actually quite common. It's very rare for me to refer out for an image. It's probably maybe 2-3 times a year if I have to. And those are very complicated cases. But for the most part, there's a lot of hope, even if you have a high back pain, to treat that. And alluding to the discs don't slip. They don't slip out. It's the verbiage we use can really instill a lot of fear in people. Know that the disc is supported by a lot of ligaments, and that, yeah, you might get some strains in that tissue, but it won't slip out. I've had some issues with some clients coming in where the doctor says, hey, don't move, the disc could slip. And the client's like, oh crap, I don't want the disc to slip out. And so they get very conservative and very fearful of moving, when at the end of the day, that will not be good for you, because you respond and heal through some movement. I want to talk about reabsorption of the disc too, just to understand that this is a thing where if you get an image, you could see a herniation or protrusion. And more times than not, one study said 70%, the disc gets reabsorbed, or the body find a ways to heal that disc. So here's one study looking at that. They have someone that came in for disc herniation, and then over time, you see how the disc reabsorbed itself without surgery, which is pretty cool. This is a personal example of actually my dad gave me these slides. Context, my dad's a neurosurgeon, so I got really interested in the back because of him. This patient came in, it had some leg symptoms, but it had this big bulge. And he's like, you know what, let's just treat it conservatively. You seem to be doing okay. 8 months later, this is what the discs look like. Same back, same person, but it cleaned itself up nicely. So he didn't have to go to surgery for this patient, which I think the patient is very thankful for. So the bottom line for this is sometimes it's hard to know the source of low back pain. Disc protrusions and herniations, though they could contribute, might be misleading as well, especially for non-specific low back pain, where you just have some achiness, especially in the morning or when you run. That's probably not a big disc issue. With the runner, there's a lot of stresses that could be placed upon the low back. For example, if you have a weak core, the muscles help absorb some of that shock. So if it's weaker, more transmits to the spine. If you have hip restrictions, which I alluded to and we'll talk about momentarily, less mobility there, more stress on the back. Likewise, for the glute strength, the thoracic mobility, and even how you land. Heel striking puts more pressure through the system. So if you modify your landing, it could reduce those ground reaction forces going through the spine. There's a study showing, hey, what do the muscles look like of people that have chronic low back issues? And what they found was these muscles, and let me orient you first. Here's your spine on the left. And in the back, these are called multifidi muscles. They go right along the spine in the back. You can feel it if you put your hand behind you. Healthy looking backs look like the image on the left. You have this fine looking muscle. Now with more chronic pain or disuse, the muscles turn to kind of atrophy. So this white signal is a sign of fat pretty much. And what's kind of telling us is that there's this fatty infiltration of the muscle, as if the muscle's not working. You can imagine if the muscles or the active system's not working, it's much more pressure on the disc, much more pressure on the ligaments to keep you stable. So this is a 2007 study with this image, and they had a low back pain associated with fatty tissue infiltration. And again, they did this in 2017, different group. It's a lack of mobility with more fatty infiltration. So just know that the muscles may not be working that well if you have this chronic low back issues. So along those lines, if you don't have the stability in the spine from the muscles, what could happen is excessive movement. There's a label for this. I don't necessarily like the name of it. It's called lumbar spine instability. And when people think it's stable, it's not going to fall out like a disc or anything like that. It just moves a little bit more. There was a guy named Punjabi, a professor that studied this. They want to see what healthy backs look like and what unhealthy backs look like. And it's very subtle, but he noticed with chronic low back issues with movement, there's more of a shearing force with the movement. What they're saying there is that axis of rotation is kind of all over the place. So if you don't have the muscles to support it, it's just a lot more prone to shearing forces. And that could cause pressure on the ligaments, on the disc, cause the muscles to spasm because they're trying to like protect this area. And if the muscles aren't doing well, the ligaments get more force, and the ligaments will get strained over time too and become more loose. So we have this feedback loop, more disuse from the muscle, more pressure on the ligaments, and that system begins to break down in the recurrence of more and more back pain. So they all kind of work together. So some muscles to help with that, like I alluded to, are the multifidi muscles. Is a huge component in research for low back issues, as well as the transverse abdominis, among other muscles. This is like the corset to keep it stable. Popular exercises with that are on the left, back holds on the ball. When you go to the gym, you can do something called a Roman chair. I do this twice a week on myself, and all my back patients get this type of exercise. So they lie simply on a ball there, and they hold for endurance, and you can make that pretty hard with weights or your hands overhead. I'll talk more about this at the very last slide. I'll give you some exercise I recommend. The other one's called the dying bug, and that works more the transverse abdominis for stability. So that's from the muscular standpoint. What about the hip mobility standpoint? Most of us probably sit for work in some capacity. And when we sit, the muscles over time adaptively shorten. So hip flexors on the front tend to shorten, and that may limit your ability for your hip to move into extension well. And if one area doesn't work well, other areas have to make up for the lack of movement. And so a very common area for back issues in regard to the hip is hip into extension or lack of hip extension mobility. This is super common. I work at a on-site for a tech company, and I see a lot of people that sit down, engineers, all day long, and this is a huge issue for this population. So to put less stress on the low back, I have a lot of them do hip flexion stretching, which I'll show you in a moment. And with that, this will help put less pressure on the low back. In terms of running mechanics, know that every time you step, it's about 3 to 4 times your body weight when you run, and that's a lot of force. So when you do a heel strike, research is showing that puts a lot more, it's called ground reaction force, but a force back up to be absorbed. And that's much higher than if you do a midfoot or forefoot strike. So the back pain could be contributed to even how you run. What kind of surface do you run on? Is it concrete versus track? Is it the trail? I forgot to mention this in the beginning too, but with back pain, just note that it's not usually a one-to-one correlation. I have weak abs, therefore I have a back pain. People have weak abs and no back pain. But there's a combination of factors too. Like I said, the strength, the mobility, how you run, all might contribute for different percentages to your low back pain. So if you have not seen how you run, I would recommend if you have a trainer or someone to look at you and take film so you can see how you strike the ground. There's a study by Nakism for the low back of what the disc pressures look like at different positions. Now, I want to bring this slide up on the right to note that different positions could affect the pressure on the low back through the day. So if you sit all day long, it's about 185% of the pressure if standing is the reference 100. And doing that through the day could just beat up your back a little bit. So you also have to think the cumulative effects on your back through the day that could beat it up. So a lot of people may not have a lot of pain, but they go bend down and tie the shoe and get a lot of pain. It could be that they just beat their back up through the whole day and then one little thing just set it off. So know that you want to treat your back well and consider the different pressures on it throughout the day that could impact the resilience of your back. Other factors to consider that I didn't quite address directly, if you had a previous injury and didn't resolve it, it's more prone to come back. As I said, daytime habits or activity, like do you sit for long periods of time? How often do you take a break are very important. Your weight, of course, if you're heavier, it puts more pressure through the back. Shoe wear, I tell people high heels, if you have back pain, hang off on that for a bit. That puts a lot more pressure on the back. You eventually get back to it, but it's not the best thing for your back. You also have restrictions in hip mobility. Say if you wear tighter pants or if you have tight belts, that could limit your hip mobility and therefore more pressure on the back. So if you have some back issues, I tell people wear something more forgiving and watch out for the belts. Standing surfaces. If you see like say Safeway stores or those any type of supermarkets, the people on the checkouts stand on a surface that's cushioned. So they found is if they change the surface what they stand on for these workers, the low back issues went way down. I think by like 40% just by changing the surface we stand on. So also what you run on, like I said, concrete, not so forgiving, tracks, asphalt's even better than concrete, or go on the trails. Smoking, less blood supply to the area will affect the healing property. And sleeping is very important. If you're not sleeping well, you're not recovering well, as well as what you eat. That's what your body makes, all the proteins. So keep that in mind as well. So the big point with this slide is it's many different things that could contribute to how you heal. These are the top exercises. If I could say 5 exercises I give my clients for back issues, this is what they are. If you had non-specific low back pain coming into me and it wasn't high pain, I'll say, hey, you know what? The top 3 is what I usually begin with. It's a stabilization program with the multifidi on the far left, the transverse abdominis with the dying bug in the middle, and the side lateral stability, the obliques on the side there. Of course, many other exercises will be important too, but these are my top 3. And then usually in follow-up, I give them the hip flexor stretch and the bridging for the glutes to get the butt active because the butt is very important. Hips are very important to help your back and knee, among other things. Good question. We actually did a topic on this called Can I Run with Pain? That talks about more in depth. To answer that question is a little bit tricky because I don't know your case particularly well. So the answer is it depends. If you have high pain, if the pain is like excruciating and a lot of pain after you're running, I might want to hold off on it and understand why. If it's some mild pain that gets better, I'll be like, okay, yellow light. As long as you're addressing some issues like strengthening, maybe checking your running form a little bit. You have to understand that pain's there to help you. Pain is trying to let you aware of something that's a little bit off. Some tissue is either being compressed too much, is being sheared too much, or being overtensioned. And the body is trying to let you know something's not sustainable here. I'm going from a demographic that usually sits all day long. So if I had to go from my demographic, it would be the best thing they can do is honestly just move more. Take more breaks at the work. Ideally, every half hour, they just walk for a minute somewhere. At least get physical activity. As you saw before, one of the risk factors for low back pain is lack of aerobic activity. And I imagine you don't have to be a big runner, but just even walking around would be very healthy for you. So if I could say the biggest issue is just lack of activity. Now, if I had to say for the runners in this population, the biggest issue I see is usually 2 things. Training error, go too hard, too soon, too fast for the tissues to adapt. I think that's one big issue I see, especially with beginning runners. And just as important is strength. Usually glute strength is not great with runners, and that helps a lot for the runner to absorb some of the forces going through and control that. Those are the top 2 that I'd see probably for our audience would be going too hard, too soon, too fast, and strength issues.